morning, Trinidad and Tobago. Welcome to the Ministry of Health's virtual media conference on the national COVID-19 response. The members of today's panel are Dr. Roshan Parasram, Chief Medical Officer, Dr. Janine St. Bernard, County Medical Officer of Health for Caroni County, and Dr. Joanne Paul, who is a pediatric emergency specialist and the Regional Emergency Coordinator for the North Central Regional Health Authority. I'm Candice Alcantara, Manager Corporate Communication at the Ministry of Health, and I will moderate this conference this morning. And today we are speaking about our children and ensuring that we get you all the information that you need to get them vaccinated. And before we go right into the information about our children, we go to the Chief Medical Officer who will give us the clinical update.
Hi, good morning, and thank you, Ms. Alcantara. Good morning to Dr. St. Bernard and Dr. Paul, members of the media, members of the viewing and listening public. So we will begin with the COVID-19 update for September 17, 2021. The number of tests done at public and private facilities so far, 3,526. New positive cases over the last 24 hours would have been 218. Those positive cases reported going up since the 12th of March 2020 to present are now standing at 48,143. Total recovered patients so far, 42,752. Our total active positive cases now stand at 3,986. And those in home isolation are 3,432. We now have 1,405 deaths, and again, condolences to the families of all of those persons who would have lost loved ones throughout the pandemic. Total number of persons in hospital now stand at 269, and those in step down at 67. In quarantine sites, we have 142 persons at this time. Just a little breakdown in terms of the vaccination rate so far. Partial vaccination, total persons vaccinated with the first dose of a 2-dose regime, and this is updated from the slide in front of you. You will see 557,693. Completed vaccinations, total persons vaccinated with second dose of a 2-dose regime now stands at 449,904. Total persons vaccinated under a single dose, 12,434. And total persons completed vaccination, 462,338. So one dose represents 39.8% of the population, fully vaccinated, now standing at 33%. In terms of the pediatric population, we have 37,657 persons receiving at least one dose, which accounts for just over 41% of the 91,000 persons in the secondary school system. This slide in front of you speaks with a little more granularity in terms of the patient disposition. Patients at the Couva Hospital and Multi-Training Facility, 54. Those persons in ICU, 8. In HDU, 11. At the Cora Hospital, we have 21. Augustus Long Hospital, 39. St. Anne's Hospital, 2. Arima General Hospital, 34. New Point Fortin Hospital, 41. St. James Medical Complex, 39. Scarborough Regional Hospital at the Fort, 34, and Scarborough Regional Hospital, Signal Hill, 5. Ms. Alcantara, that brings me to the end of the clinical update for this morning.
Thank you very much, CMO. As I mentioned before, today we are focusing on our children, and we have an expert here who can really break down information on vaccination for children. So parents and those 12 to 18, please listen intently to the information from Dr. Paul.
Hi, good day. Thanks for having me. Chief Medical Officer, Dr. Janine St. Bernard, members of the media, ladies and gentlemen. I'm here today to speak to you about the common questions that is often asked by parents and usual persons, and also to think about the projection of what the next few months might have for us. So the first thing, just to go back a little bit, we know we have had the pandemic for the past 18 months, and in it we have had mostly 3 categories of COVID-19 infection in children. It's been mainly We've had the ones who have been asymptomatic. So, of course, those have been the majority of the population in terms of the children. They have had no symptoms whatsoever in terms of them having infection with COVID-19. We've also had a smaller category, almost like 2% of those who have had severe COVID infection and those who have been hospitalized. We have had the other category, as you've mentioned before, it's MIS-C. So that's the multisystem inflammatory syndrome in children. And to date, we have, as per what Dr. Ronan Ramrup has reported, and he's the pediatric cardiologist who has been following up with these patients, in addition to Dr. Vanita Shukla, who is the neurologist. We have had 55 confirmed cases of MIS-C up to this date from April last year to now. Interestingly enough, though, we have had the most in the Caribbean. In fact, we're about maybe 4 to 5 times per capita more than any Caribbean country. We're not sure why, but we know we've been having them confirmed, treated, and there have been no cases, no deaths so far from MIS-C in Trinidad at all, which has been great. All right, so we've had those 3 categories in the past 18 months. So the first question that most persons ask in terms of if we have been having mostly asymptomatic cases in children and they've been mild, why do we need to vaccinate our children? Now, in the beginning, before the game changer of Delta virus, we had it where it was all about herd immunity. If we can get more persons vaccinated, including our children, we'll be able to go back to schools, etc. The thing about how vaccination works in terms of just a visual. So if you have an unvaccinated population, the virus just goes from one to the other really fast and it accelerates. It's almost exponential. It's almost like an avalanche, so it goes through really fast. But with vaccination, it's like having mini breakers. So as soon as it goes from here to here, it stops it, it slows it down. So you don't have that surge happening, that acceleration happening. So in fact, a vaccination causes 3 things. 3 reductions: a reduction in surge, a reduction in ICU, reduction in deaths. We're looking at those 3 things. I repeat, a reduction in surge, which overwhelms the hospital capacity, a reduction in ICU cases, a reduction in deaths. So we were pushing with that in terms of trying to make sure we had herd immunity for our nation and for our children. But then came Delta. And with Delta now, it's definitely much more transmissible. And so what happens is that it's now tackling that group of unvaccinated personnel, and it's going towards the younger persons and the children. So now we have the extra aspect where we have to make sure and give extra protection for our children. If you look at Jamaica, Bahamas, look at all the other countries in the world, you've seen that change in terms of the age group and is moving towards that. And we're seeing in terms of US and other countries in Europe, and where we've seen a lot more children have been hospitalized. So our mainstay right now is not just about vaccination, it's about vaccination in children for herd immunity, for going back to schools, and for their general protection with regards to our Delta variant. The other question I'm often asked is that about side effects. Some persons tell me, well, I've seen so much stuff in the media, the side effects are real, it's a bit scary. What do you think about that, JP? So the thing is that we know in terms of numbers, side effects of the Pfizer vaccine is usually about 1 to 2 per million in that age group of 12 to 18 years old. It's been shown by all the data. 1 to 2 means that for our population of children to be vaccinated, we'll have maybe 1/5 a case that might be myocarditis or pericarditis. So those are 2 like separate side effects. The major one, pericarditis, or if you have an allergic reaction. Let's look at the first one though. We're seeing some cases, etc., in the newspapers, and persons have been talking and sending WhatsApps. The reality is, in terms of real significant myocarditis or pericarditis, we've had none. What we've found, most of the side effects have been anxiety related and anxiety associated, heavily so. So children, especially in that age group, might be so anxious that they might have chest pain, and it's just a matter of having some stomach irritation. They feel they might have vasovagal episodes where they feel a bit faint. But once you resolve the anxiety and they're reassured, their symptoms go away. So in reiterating, in terms of myocarditis and pericarditis, we've been having none, no real in significant cases of side effects from the Pfizer vaccine. In terms of the allergic reaction or anaphylaxis, in terms of looking where in real anaphylaxis, your tongue becomes swollen, your lips are swollen, your eyes are swollen, your face is swollen, you have a rash all over, you can't breathe properly, and you have lots of multi-system effects. We have had no real or significant cases of side effects of that. Let me repeat that. None. I hope that's clear. It's mostly been anxiety related, which you understand, which going back to my next question, which persons often ask is that why is it, should we really have schools open if we're worried about infection with our children and we have them in schools, but we have more infection there? So the real twist of the question should be, what can we do to safeguard and protect ourselves to open schools? Now, parents have to understand. I think they do, but I think we don't really fully appreciate that in the adolescent period, especially the classmates in school are children's families. The concrete thinking of the adolescent population is where that colleague is more important sometimes than even your family. So they haven't been seeing their families for 18 months. So with that, you've had mental health issues, anxiety. We depend on schools to actually help them socialize, to make them become young adults, good young adults who will be able to function in society. So we've not been having that. So a lot of them don't know how to function. They don't know about their friends. In fact, it's no longer cracks now. It's potholes we've been having through the system. They've been falling through the potholes in terms of not having school for 18 months. We have to, for our children's sake, we have to get back to school. So to me, it's a matter of vaccination of your children, of the teachers, of the administrative personnel in the school to make sure we're able to get our children back into school. Now, of course, when we do have them in school, we are going to have increased infection because more are in the particular area. There's going to be some transmission. But once they're vaccinated, we're not going to have the surge, ICU cases, and the deaths. Remember those three things? That's what vaccination prevents against, and that's the decrease we're looking at. So the other questions I often get asked is that why should I put some strange injection into my child's system? And the fact is that, it's not a strange injection. We're looking at it in terms of a really tunnel vision that is, so there's this new vaccine. Vaccines have been around for ages. They have been saving our lives for ages. We have had polio vaccines, all the things you don't see very often. Tetanus, we haven't had a case of someone dying from a dirty wound for a while because of tetanus vaccines. We've had polio, tetanus, diphtheria. We used to have something when, of course, because I'm so young, it's before my time, but there was something called epiglottitis where in a few years ago, lots of children used to die from that, but now we have vaccines against that. So in terms of just going traveling, we usually take the yellow fever vaccine. When I was going away to Australia, I had to get my hepatitis B vaccine as a normal stance. So vaccines have been around with children and adults. It's not a strange injection. We're just seeing it very tunnel vision for this. We haven't had a vaccine against corona, but in terms of vaccinations, it's the same mechanism that we have had for years for us as for our children and for us as adults. So the thing is, in terms of the projection of what's going to happen, the reality is in the next few months, we're looking at maybe boosters. I mean, that's as the data comes up, we'll have to follow what the WHO is suggesting. But we have boosters coming up. We might also have new for the vaccines that's approved, and it might be Sinopharm that's approved for children. It might be more vaccines for children who are less than 12 years old. But really and truly, we're looking at variants. We're looking at that roller coaster of having more variants until the population in the world has had enough vaccination to reduce the amount of variants. we are going to have a roller coaster. And so my colleagues asked me, how long do you think, Joanne? I think it's going to be that it's going to be endemic, but I think before that, we're going to have maybe 6 months or to a year or more of having some roller coaster, of having variants, while we try to have that sweet spot where we balance the economy and our health and infections, and trying to have it where we don't have that surge, ICU cases, and deaths. And the key thing here is vaccinations. All right. So, in terms of my last reminder before I go, I want to reiterate to the population that when you protect yourself, try to think of 4 different things in terms of your layer of protection, and they all add to each other. First thing, in terms of public health measures, wash your hands, wear your mask, watch your distance. That's the first layer. The second layer is vaccination. We have to live with it. We have to adapt to it. We have to vaccinate against it. We have to live with COVID. It's our new normal. There's no matter of let's wait. Because I ask persons, why no vaccination? They'll say, well, I'm just thinking about it. I'm waiting for a while. No. Waiting for what? Because it's going to be with us for a long time. Let's do it now, okay? Let's go get our vaccination. The third layer is our immune system. We got to make sure and strengthen that immune system. And the fourth layer, as usual, is our mental health. Remember, our mental health balance also affects our immune system, so we have to have that there. So think about that, ladies and gentlemen, and go vaccinate now. Thank you very much.
Thank you so much. And one of the important things that really stood out there was preparing your children mentally and ensuring that they're comfortable as we move forward to protect them physically. And we go now to Dr. St. Bernard. You know her. She has been here before giving us updates on County Caroni. But today she's wearing a different hat, the hat of a parent. So she's not just a medical doctor, but she's a parent who has allowed her children to take the COVID-19 vaccine. So let's go to Dr. St. Bernard to get her perspective on this very important topic as we seek to ensure our future and protect our children from COVID-19. We go to Dr. St. Bernard.
Hi, good morning. Good morning, CMO Dr. Roshan Parasram. Good morning, Dr. Joanne Paul. Good morning to Ms. Candice Alcantara. Good morning to the viewing and listening public. Good morning to the media. Thank you for having me yet again. And as Ms. Alcantara has said, today I am here as a parent. I am here to talk about my experience of vaccinating my children with the COVID vaccine. So, Dr. Paul has already discussed the importance of the vaccine and why kids should have the vaccine, but I will speak about why I took my children to have the vaccine. And I can start by saying that the experience that I had was a very pleasant one. On the very first day that the vaccines came out for the children, I took my children to the COSTAT site, which was actually close to being closed. It was in the afternoon, but it was a very seamless process, very well labeled, so you knew exactly where you had to go. Very professional staff. They didn't take very long, and my children were very comfortable. Of course, after the vaccine, you sit and you get observed for a little while. There were many doctors around asking, how do you feel? And that was it. First dose done, check. Then for the second dose now, I was not on time for getting the second dose at the very same site. So I actually did have to make some calls, and I was advised I can then go to another vaccination site for the children. So this one was very pleasant and very exciting because we ended up now taking a road trip to get the second dose of the Pfizer vaccine for the children. So this was at the Wallerfield, the Frankie Boudram Wallerfield International Raceway, as we see there. And that was also a very seamless experience. When we got there, there were very few cars, which was surprising to me because I thought, a lot of parents would have been there practically every day. But basically, it was just literally a drive-through. You go to one tent, they give you the forms. You go to another tent, they check your documents. You drive to another tent, they administer the vaccine right through the window. They just come up to your window. They administer the vaccine, and then you drive to another tent where the doctors were waiting to observe and find out if there were any side effects or any negative experience at all. And then that was it. We were out of the Wallerfield drive-through vaccination site. And I think for my kids, it felt like, like usual. And, I will say as a mother, When my children were 2 months old, there was no question of would I be vaccinating them. They were taken for their 2 month, their 4 month, their 6 month shots. Before they entered school, I had to vaccinate my children, as most of us would have to do before they entered primary school, and they would have received their vaccination shots. So for me, in particular, right now, and for my children's sake, I thought it best to get them vaccinated. My children miss being in school. In-person school is not the same as the virtual. Virtual, I know everyone has been trying, and it's been a while. And as Dr. Paul has said, and I have to endorse that, these kids, their friends are like family. Literally, sometimes those friends in class are actually sometimes more important, and their opinions are valued higher. I was actually looking today at the benefits of in-person education, and I think, there's an ad that says, take the shot, get back to life. We need to get back to life, and my children want to get back to school. And so the in-person learning environment allows things like the holistic experience, getting to answer questions from your teachers directly and in person, working on projects as a team, together, solving problems. Even things like the types of learning that the in-person environment will allow for. It allows for all 4 types. We know about the auditory and the kinesthetic and so on. And the in-person learning allows for children like 1 or 2 of my kids who need to have the hands-on to learn. They are missing out on that. So that is a reason as well that I really, really would like my kids to get back to school. Even the emotional benefits that Dr. Paul spoke about, where you get to bounce ideas off your friends, share concerns that you have face to face. Kids need that face to face environment to really thrive. And let's not forget, the National School Dietary Services Limited also provide hot, healthy meals for our children in secondary schools as well, not just the primary schools. So our kids who are vaccinated can, and then get to return to school, would have access to those meals, for those kids that do access those meals. And then, for my children who play sports, they play music, my boys, they're missing football. They can't play in-person football and get together with a team because of the vaccination issue. So we're looking forward to being able to do that again. My daughter plays violin. She's into music. We can't have in-person music classes because of the vaccination. So for me, I absolutely endorsed and rushed to get my children vaccinated because I wanted to do my part to ensure that this thing that I want, this thing that we need for our kids, I was able to make a step towards that. I was able to contribute towards that. So for me, what the vaccination represents is a return to a balanced life, a healthy way of life for my kids. And so I encourage everyone, no matter what, if you can go and take your kids to be vaccinated, any day, take them. Don't delay. Don't be afraid. The vaccines are safe, as they always have been. We've said it. And, we really want to go with the science and the facts. I have done it. I feel safe. My kids, in terms of side effects, pain in the arm. That literally was it. They had some pain in the arm and, of course, good old paracetamol, Panadol. And it was, the symptoms did not last very long. And they knew they were doing something to contribute. So even when they asked their friends, who has been vaccinated, raise your hands. And that would have been an interesting conversation as well. But please, I beg all parents, take your children, get them vaccinated. Let's get back to life. Let's get back to school. Let's get back to sports. Let's get back to having our children have a very balanced and holistic experience of life as they were meant to have. Thank you.
Thank you very much. And I know that we have some parents there that have been convinced. You see that we have Dr. St. Bernard here who is walking the talk. Our pediatric expert has given you expert advice. So we really want to encourage you to take the step to get our children back to a more balanced way of life. And in case we have parents who are not sure where they can take their children today, just some of the locations where they can take children 12 to 18. And of course, the vaccine is also available for adults. Larry Gomes Stadium, that's open today until 3 p.m. The Wallerfield Raceway, that is actually a drive-through, and Dr. St. Bernard mentioned that location. That's open until 4 p.m. today. Sapa is open until 3, and the Southwest Regional Indoor Facilities also open at 3 today. So take your children to be vaccinated, and if you aren't vaccinated, get the adults in the family vaccinated so that you all are protected and can help to protect each other. We go now into the question and answer segment of the media conference. All media representatives, Please remember to indicate your name and the media house that you represent before posing your question. We ask for no more than 2 brief questions, please. And please ask both questions at the same time. And if time allows, we will come back to you and accept additional questions this morning. We begin with questions from Newsday.
Susan from Newsday. Dr. Paul mentioned that 2% of children had severe COVID infection. So can we get a number for that, please, rather than a percentage? And as well, she also mentioned that there have been no significant cases of allergic reaction. However, last month, we had a video and a report of an allergic reaction in a child, and we saw her in a stretcher and so forth. So what exactly is significant, if not something like that?
Thank you. We'll go to Dr. Paul for a response.
Hi, thanks for that question. So in terms of the 2%, I know that we've had some figures done by the Ministry of Health, so I'll let that be answered by the CMO if he wants to in terms of any numbers. But really and truly, with regards to the second question with the allergic response, so I'm not going to detail anything. I know that was on Facebook and in the media. I'm not going to go for the detail about that patient because I'm not going to discuss their personal points. But the fact is that the patient was transferred to the emergency department and was assessed there. And the thing is that if you have an anxiety attack, you may feel that you part of the anxiety attack is when you feel that I can't breathe. It's almost like hyperventilating. When the patient was assessed, what we found is that there was, as per lots of other cases, a lot of anxiety-related symptomatology. So I can assure you, because I was involved in that patient's care also, and the others who have come through, and most of them, we've gone through most of the cases, and it's mainly been an anxiety component. So I'm not going to say any further, because that's the patient. I'm not going to go into patient confidentiality. But if you're having anxiety related episode, you can be lying on a stretcher. You can feel a bit nauseous. You can be feeling a bit faint, and that's a normal anxiety related. But after a few hours, after we have reassured you, calmed you down, you do feel better. A real allergic reaction, a significant one, is where I'm totally all swollen up. I have other manifestations in terms of my blood pressure being low and various other things. I have to get some medication to deal with that, much more than what we've seen so far. Thank you very much.
Thank you very much. And Ms. Cutting, we'll get back to you with the number for the 2%. If we get it during the conference, we will pass that on to you. We go now to TV6, please.
Hi, good morning. Vanessa Cutting, TV6. Both of my questions are for the CMO.
Sorry, we're not hearing very well. Just give us 1 second. Let's adjust the volume there, and we'll go to AZP News while we adjust the volume for TV6. So let's go now to AZP News. I believe that we have Priya Bihari there.
Hi, good morning, Priya Bihari, AZPnews.com. Dr. Joanne Paul, she spoke about booster shots. I don't know if you can say how soon can we expect these booster shots, and when you would be administered. One, and my second question, or maybe the CMO, the Minister of Health said out of the 1 million doses that have been administered in Trinidad and Tobago, there were six severe reactions. Can you state what these reactions were and the ages of the people in which they occurred? Thank you very much.
Yeah, so I think in terms of your second question, what he had said, if I listened correctly, I think he said 5 persons were reported to the Pan American Health Organization of having some sort of untoward events related to a vaccine at some point of time. There has been no deaths related to vaccination in Trinidad at this point in time, just to make that part clear. But it is our responsibility to report to PAHO and, of course, the manufacturers if they have side effects or adverse reactions occurring, so they treat it as part of the global statistics related to that particular vaccine. I can't go into, as you know, ages of different people, but as you know, we would have had some in the early days related to the AstraZeneca vaccine. We would have been on this program as well, saying the type of reactions we would have seen in terms of thrombotic phenomenon. Those patients, to the most part, have been doing very well in terms of the clinical management. We have had some mild allergic type reactions as well to various types of vaccines. So that's the ones that we have reported upstream to PAHO as part of our electronic reporting mechanism to the Pan American Health Organization. In terms of your first question on boosters, and I don't know if Dr. Paul will add when I'm finished, but generally speaking, as you know, there hasn't been any approval from WHO as of yet for the use of booster vaccines. There are certain jurisdictions around the world that have begun using booster shots for Pfizer, for example, as a third shot in vulnerable groups of the adult population. For example, people that have, I suppose, diabetes, cardiac disease, asthma, and the like. And those diseases make you, of course, more prone to the complications of COVID-19. And that subset of the population is where we're looking at possibly doing boosters at some point down the line. But again, the approval hasn't been given as yet. And we continue to look at the data coming back at us in terms of the way the immune system responds. With regards to Pfizer's response in children in particular, what has to be noted is that with children, you're seeing a much better immune response than in the adults. With a 2-dose regime, you're seeing just under 100% protection from severe disease and death with Pfizer. So it's almost 100%. Some of the literature actually says 100%. But I think there's always a reason to go a little bit less. So the response for Pfizer in children is extremely good. And is another reason why really and truly for your children and the protection of your kids, you need to have that vaccine as soon as you can. In terms of having the vaccine as well, I looked on when my CMO colleague in Jamaica would have made the statement a few days ago that they had 11 deaths from COVID-19 in children. I don't think we want to get to the stage in Trinidad and Tobago where we have to make a similar announcement. And we're really standing with Dr. Paul and Dr. St. Bernard and making a plea to parents. We have vaccinations at our disposal. Let us use it to protect our children. I think it is incumbent as a parent to have your child vaccinated to protect them from this disease.
Thank you very much, CMO. And I think Dr. Paul had something to add.
Thanks for that. Just to add to what the CMO was saying, we definitely follow the WHO standards, and rightly so. We want to make sure that the data has been assured, approved, and make sure we're following in terms of international lines. What I wanted the population to appreciate is just how uncertain and how much of a roller coaster the next few months will be. So a few things might be coming forward, but at each step we'll be reassessing, looking at the data and listening to the approvals from WHO. So not yet for the booster, but it might be coming. But as with every few weeks we have some different information we look at, reassess, and then determine from there. Thank you.
Thank you very much. And we go now to TV6. And unfortunately, the volume is still a bit low from Ms. Cutting. Let's try one more time.
Hello, Vanessa Cutting, TV6 here.
Oh no, it's a little quiet for us, so we will try back again with TV6. Some other information. So I mentioned, of course, that the locations for Pfizer vaccination, but also a reminder that today we have the One Shot and Done initiative that's happening at locations throughout the country. So from 1 to 6 p.m., get ready to get vaccinated. Now this is the 1-dose vaccine. So 2 weeks after getting this vaccine, you'll be considered fully vaccinated. Gulf City Mall, we have the C3 Center, Massey Stores in Marabella, Price Mart, Chagonas, Trin City Mall, Price Mart, Invaders Bay. That information should be in the print media today. It should be on radio. And of course, you can look at the Ministry of Health social media. From 1 to 6, you have the opportunity to go and get your 1-dose, single-dose COVID-19 vaccine. Of course, all the vaccines that we use in Trinidad and Tobago a World Health Organization approved, so you know that the vaccine is safe and that the vaccine will work to protect you and your family. Let's try again with TV6, Miss Cutting. Miss Cutting, let's see if we can hear you any better now. Oh no, we really seem to be having trouble there. And Miss Cutting, you can probably send your question in to my phone. I know we communicate sometimes that way, and I can probably get an answer to your question. Just another thing to remind persons, we have been talking so much about vaccination, but there will of course be persons who cannot be vaccinated at this point in time. We know that we're vaccinating from 12 and up, and we've been talking today about protecting our children. One part of protecting our children, those under 12, is ensuring that as much as possible that those around them are vaccinated. So we create a little bubble of protection for our children. We really encourage everyone, please, to go out today, get vaccinated, but also to continue to follow the guidelines. We talk about the 3 W's. Wash your hands or use hand sanitizer. I see people just putting a little water in their hands. You really need to wash the hands properly. Inner palms, the back of the hands, between the fingers. 20 seconds is what we're looking for. If not, use hand sanitizer.
Yeah.
Hand sanitizer needs to be used for that much at that same length of time until it dries. Wear your mask. You see, we all have masks. Ever so often we may adjust because we want to make sure that it fits snugly but comfortably, covering the nose, sides of the face, the chin, and watch your distance. We really want to remind persons, even if you have been vaccinated, you still need to follow these guidelines. And we are ready now with the question from TV6.
Hi, good morning. Vanessa Cutting, TV6 News.
Wonderful. We hear you absolutely clearly now.
Great. My questions are for the CMO. I would like to know how the differentiation is made between an adverse event and a regular side effect. And I'm asking that in the context of this whole the trending topic right now with the alleged testicular swelling, because I personally know now 3 females who have reported to me. One of them is my close friend. Extended bleeding, menstrual bleeding following the vaccination, and I also saw a thread on Twitter with multiple females in Trinidad reporting changes to their menstrual cycle. Some have been having extended, prolonged bleeding. My friend is now 3 weeks in, and some have been having the opposite effect where they have spotting or no periods and things like that. So the second question would be, has the ministry received any official reports of anything of this nature? And how do you all differentiate between a side effect and an adverse event, given that the health minister would have said we've only had 5 adverse events reported? Thank you.
Yeah, so generally speaking, from the beginning, when we decided to have this discussion as side effects versus adverse events, it is more or less a clinical distinction you have to make. So you have to be assessed by a clinical care provider, and they make that decision for you. But generally speaking, a side effect is something we were classifying as a very mild event. For example, as Dr. St. Bernard would have said, our children would have had pain at the site of the injection. It's a very common side effect. Tends to dissipate in about 2 days or so. People get fevers, which are usually mild, going away in about 2 days as well. General feeling of lethargy, feeling a little tired. Those are examples of side effects, and they're usually mild. They resolve on their own. They don't last very long post-vaccination. Adverse reactions are reactions that tend to have basically severe reactions in terms of your bodies. So severe allergic type reactions that we have come to know. Dr. Paul would have gone into some detail with swelling of the face, sometimes swelling of the different parts of your body, eyelids as well. You tend to see it a lot in urgent anaphylactic reactions. Persons are prone to fainting as well. So it is a classification based on clinicians' determination, generally speaking, or signs and symptoms. So more severe are classified as adverse reactions, very severe, and those are usually ones that tend to be reported through the electronic surveillance system for reporting of vaccine side effects. Reporting upstream, as the Minister would have said, we had 5 that we reported to PAHO, which we considered significant enough to report to the Pan American Health Organization. In terms of I haven't received myself as yet any adverse reactions related to changes in the menstrual cycle. We will have Dr. Surjit Singh possibly on next week during the press conference to have a discussion on possible side effects as it relates to changes in the menstrual cycle related to vaccination on the whole. But of course, if you're having any of these, please visit your healthcare provider as soon as possible and let them do an assessment. I hope that answers the question.
Thank you very much, CMO. And I don't think we have any further questions this morning. I think our experts have been so clear that we don't have any questions, and you all understand the importance of getting our children vaccinated. And so before we go, I will just remind you of the locations where vaccination is taking place today. So those 12 to 18 approved COVID-19 vaccines are available at Larry Gomes Stadium until 3 p.m. The Wallerfield Raceway, that's a nice drive-through experience for the family, and that ends at 4 p.m. But please don't all go at 4. You can pack something and take the drive there now. Sapa is open until 3 p.m. for vaccination, and the Southwest Regional Indoor Facility until 3 p.m. And of course, our One Shot and Done initiative from 1 to 6 p.m. today. So you can shop and be vaccinated, stay for a bit while you're observed, and then go home. Gulf City Mall, C3 Center, Massey Stores, Marabella, Price Mart, Chaguanas, Trin City Mall, and Price Mart, Invaders Bay. Thank you everyone for joining us this morning. Remember, together we can manage the COVID-19 pandemic. Protect yourselves and your loved ones, especially our children, by following the 3 W's and getting vaccinated now. Don't delay. Let us fight back against COVID-19. Let us vaccinate TNT.
I chose to be vaccinated to protect and serve.
I got vaccinated for my family.
I got vaccinated for my country.
I got vaccinated for you.
I choose to be vaccinated for TNT.
I vaccinated for me.
For my family, for my colleagues, for my country. Vaccinate.
Let's do our part and vaccinate.
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 Let's vaccinate TNT.
Vaccinate.
After we have been exposed to an infection, our immune system remembers the threat, in particular by producing antibodies. These are proteins that circulate in the blood and throughout the body. They quickly recognize and disable